Hi, myself Dr. Gautam Banga. I am a consultant urologist with Sunrise Hospital and I have expertise in urethra and penile reconstructive surgery. Along with that, I take care of andrology and routine urology cases also. In routine urology, the most common cases which we get nowadays are stone, prostate, and along andrology we get lot more patients with male infertility and erectile dysfunction. Today I am emphasizing on erectile dysfunction because it's a thing which is growing very fast in our society, and with the adaptation of the Western culture, the number of cases which we are seeing every day are increasing exponentially. The causes of erectile dysfunction in Indian society initially were more of psychogenic because people were having a lot of expectations from themselves, and they used to come with some irrelevant problems. But nowadays, with changes in the lifestyle and the type A personality, that is people who are working with MNCs or working late hours and doing too much of hard work, they come with these erectile problems very frequently. The causes is that people are having a lot of addictions also nowadays, like in the form of smoking, alcohol, and other recreational drugs which affect their erection and erectile abilities. So nowadays the trend in the world or in India is more of organic cause of erectile dysfunction than psychogenic. And so most of the people who come to us really require counseling as well as treatment in form of either medication, injection therapies, or in any of the things are really severe, we have to go for implants also. Erectile dysfunction, we always qualify this as, it's not a disease but it's a problem which is affecting, so we have to define it. And erectile dysfunction is the inability to achieve erection during the sexual intercourse. And if the patient have even a partial erection, we categorize in that category only of erectile dysfunction. If a patient comes to us with erectile dysfunction, we first start with a proper history in which we consider all aspects of the patient's life, like whether he is consuming any drug, whether history of any trauma, how is his married life, and or his relationship with the partner. And we also take into account his physical examination. We see the size of the testis, size of the penis, we see how his build is. Most of the patients who come with erectile dysfunction are obese. So obesity is one of the things which predispose to erectile dysfunction. So once we are done with the history part, we move on to the investigation. So the relevant investigation which we address the patient to is our hormone profile, which includes serum testosterone, which is a male hormone, and along with that we do prolactin, serum prolactin, and routine blood test, and also along with that lipid profile. And then we evaluate the patient for the psychogenic component, because we have a psychiatrist and psychologist on board. They do proper evaluation of the patient from the psychological point of view, and if there is some psychogenic element, that is taken care of by the team of psychologists and psychotherapists. And then we move on with the treatment part. If the patient have a genuine erectile dysfunction which is having an organic component, we start with oral medication. We don't have a lot of oral medication option, but the drugs which are available are from one group, and they are not over the counter, but they are easily available, and that consists of sildenafil, tadalafil, and vardenafil. So these drugs patient are starting on these drugs. These are not drugs which are to be taken daily. These are drugs which are to be taken only at the time when they need erection. So it is as and when required, not on a daily basis. 50% of patients respond very well to medication, and they are happy to continue taking medicine. They don't want to go for any further investigation or any other treatment. The contraindication with this medication are if the patient is having some heart disease, or if they are taking nitrates, or any history of coronary intervention. These patients we normally don't advise these oral tablets because they can lead to increased palpitation, arrhythmia, or they can cause hypotension also in this patient. If the patient doesn't respond to oral medication, then we have few other options which include intracameral or injection directly into the penis. We can teach patient about vacuum therapies. A vacuum pump is the new thing in the market and is marketed very heavily. The only problem with vacuum pumps are that it has to be used by the patient himself, and the results are not the kind of erection which we get with vacuum pumps are not of the quality which we get, which is not of it's not similar to what a normal erection is. The penis is cold, a bit numb, and patient can have pain later on. But there are few people, like around 25-30% of patients who feel happy with the vacuum. The thing is because they can have erection any time of the day and they don't have to consume any medication. Intracameral injection is a boom to the treatment of erectile dysfunction because it's easy to use and patient respond very well to these injectable therapies. It's a self-use thing. The patient has to inject directly into the penis by himself, and the erection, around 80% of patients respond very well to intracameral injections. Intracameral injections are available in various combinations. We can use either a single drug, 2 drug or 3 drug, depending on the kind of response the patient gets out of that. The side effect, or you can say the problem the patient can face with intracameral injection is pain, difficulty in injection, putting the injection in the penis, or patient can have some amount of fibrosis or hardening of the penis at the area of injection. But overall, it's a very safe procedure. There is one probability of landing up in sustained erection, which is known as priapism, which is some of the percentage of the chance of having that is around 3 to 5%. But if it's taken in a normal dose and once a day, the patient chances of getting priapism is very less. If the patient is not happy with the vacuum or injection therapy, then the last modality, or you can say the best modality which remains, is penile implants. In penile implants, it's a surgical procedure in which we put prosthesis directly into the penis, into the place where the blood actually flows. We put this implant, and the patient can have erection as whenever he requires that. Penile implants are available in you can say various categories, and the cost varies with the category. There are semi-rigid, inflatable 2-piece or inflatable 3-piece. So that's the kind of processes to be planned decided by the doctor as well as the patient, because the financial part is a concern in that, because cost varies from 1 lakh to 4 lakh rupees depending on the size of the depending on the kind of implant. So penile implant surgery is very safe and it gives very good result, which is leading to erectile problem. In this patient, medication are not very much useful, as well as intracameral injection are not very helpful. So we have to resort to penile implant. And there are few people who have taken the medication, but they don't want to continue on medication anymore, and they don't want to try any other modality like injection or pump. Then penile implant is the best option for them. And there are many patients who come to us saying for how long they can take the medication, the pills. Well, there is no defined time period for which you should take the medication, or because these medications are short-acting drugs, and you have to take it as and when required. And there are people who are taking it for last 10-15 years without any side effects, because they don't have any long-term effect on the body. But most of the patients, there are many patients who has taken to take medicine for 4-5 years, and then they want a permanent solution in the form that whenever they want erection, whether it's night or day or morning. So for them, eventually we have to resort to penile implants, because that's one-step permanent solution for erection problem. But in this scenario, I feel drugs are still a better option in the initial phase because we can actually see how good your erection are with the medication, and if you're not getting the result